Menstrual cup. A menstrual cup is a flexible, bell-shaped cup made from medical-grade silicone, rubber, or elastomer. It is inserted into the vagina during menstruation to collect menstrual fluid. Unlike tampons or pads, it doesn't absorb the fluid but rather collects it, which can then be emptied, rinsed, and reused. 2. Design. 1. Shape. Typically, menstrual cups are bell-shaped with a round rim at the top and a stem at the bottom for easy removal. 2. Material. Most menstrual cups are made from medical-grade silicone, rubber, or thermoplastic elastomer, all of which are safe for internal use. 3. Size. They come in different sizes, usually small and large. 3. The size depends on factors like age, the number of vaginal births, and menstrual flow. 3. Some brands offer additional size options for those with different anatomy. 3. Types. There are several brands and variations of menstrual cups, but they mostly fall into two categories. 1. Reusable menstrual cups. These can be cleaned and reused for many years. 1. Popular brands include Diva Cup, Lunette, and Moon Cup. 2. Disposable menstrual cups. These are less common and are designed for one-time use. 2. They are similar to tampons in that they are discarded after one cycle. 4. How it works. 1. Insertion. To use a menstrual cup, you fold it, usually in a C-fold or punch-down fold, and insert it into the vagina, where it will open up and create a seal against the vaginal walls. 1. The stem helps with removal. 2. Collection. It collects menstrual fluid rather than absorbing it. 2. This allows you to leave it in place for up to 12 hours, depending on your flow. 3. Removal. After use, the cup is gently pinched at the base to break the seal and then pulled out. 3. The menstrual blood is emptied into a toilet or sink, and the cup is cleaned with water before being reinserted. 5. Benefits. 1. Eco-friendly. Menstrual cups are reusable and can last for years, reducing the amount of waste created by single-use pads and tampons. 2. Cost-effective. Although the upfront cost is higher than disposable products, a menstrual cup can last for several years, making it a more affordable option in the long term. 3. Longer wear time. A menstrual cup can typically be worn for up to 12 hours, which is longer than most tampons or pads, making it more convenient, especially for overnight use. 4. Less risk of toxic shock syndrome, TSS. Although there is still some risk, the risk of TSS is considered lower with menstrual cups compared to tampons, which are made of absorbent materials. 5. Comfort. Many people find menstrual cups to be more comfortable than pads or tampons, as they don't feel bulky and are not visible. 6. Health-friendly. Menstrual cups do not contain harmful chemicals or fragrances that are found in some disposable products. 7. Capacity. Menstrual cups can hold more fluid than pads or tampons, which is especially beneficial for people with a heavy flow. Challenges or considerations. 1. Learning curve. It may take some time to get used to inserting and removing the cup, but with practice, it becomes easier. 2. Hygiene. It's important to clean the cup thoroughly to prevent infections. 2. Some people may find this off-putting. 3. Size and fit. Finding the right size for your anatomy is important to ensure a comfortable and leak-free experience. In summary, menstrual cups are a sustainable, effective, and cost-efficient way to manage menstruation. They are suitable for many women but may take some practice to use correctly.